Sexual dysfunction is a broad term and covers many ailments to do with men's sexuality, more particularly the ability of a male to achieve and maintain an erection. We can't deal with all of these dysfunctions in detail, nor in precise medical terms, so rather than go into explicit detail, we would prefer to spend time suggesting possible solutions. One of the most traumatic conditions is prostate cancer. The prostate is small in size and similar in shape to a walnut. It lies above the urinary tract in males in the lower part of the pelvis and forms an integral part of the penile circuit. Unfortunately, it's in a difficult location to get at, wedged between other organs, and as a result, quite difficult to operate on. Additionally, the organ is prone to harboring cancer cells, and these cells, if not detected, can travel through the body to the lymph nodes and other vital organs. Lying on both sides of the prostate are ribbons of nerves. These are actually attached to the outer walls of the prostate. These little critters are an essential part of the neurotransmitter system traveling up the spinal cord, sending signals to the brain, which in turn manufactures chemicals to create semen and trigger blood flow to the penis, which enables an erection to take place. The existence of cancer cells, unfortunately, can go undetected, and in more aggressive cancers, can invade other parts of the body and cause serious damage, potentially leading to death. For this reason, doctors advise their patients to have annual or biannual checkups to ensure your prostate is clear of cancer. In frequent cases, a patient may become aware of the need to urinate more frequently, particularly at night. A visit to your doctor, where he may perform a basic test, using a gloved, lubricated finger inserted in your anus to feel for any unusual growths on your prostate gland. He'll generally order a pathology blood test to assess your PSA levels. These levels, usually around 2.5 to 3, are a good indication of the presence of cancer cells, with a reading above 5 as a cause for concern, and higher readings of 8 to 10 setting off alarm bells. But don't panic yet. If these levels are high, you may be referred to a urologist. They'll perform additional tests, normally taking 8 to 12 biopsies of the prostate via a series of injection probes. The results of these biopsies will determine whether there's a presence of cancer and the grade of the cancer, meaning whether it's benign or up the scale, more aggressive and needing to be dealt with. Then comes the decision as to how to deal with it. There are 3 main options: chemotherapy, open surgery to remove the prostate, and keyhole surgery, a more modern practice considered less invasive and with a faster recovery time. In the case of keyhole surgery, the prostate is broken into small pieces and extracted using a suction device. Chemotherapy is a third option, but doesn't appear to be used often, as there's the possibility of damaging other tissues or organs in the area. The main thing to consider with any of the above is the preservation of those nerves running around either side of the prostate. If they're damaged or compromised in any way, their important function will be impaired. Now, this is where it gets tricky. The prostate, being in a fairly inaccessible spot and a confined area, needs an expert with deft hands and experience to deal with its removal. In my case, I did my research, got the best urologist available, and he stuffed up. My prostate was slightly larger than normal, making the job of removal more difficult. As a consequence, my urologist recommended an 11-month program of hormonal therapy to reduce the size of my prostate prior to the open operation procedure. This matters, as in either procedure, an important function is to retain the 2 nerves attached to either side of the prostate, as these have to be pared away and retained prior to the prostate's removal. I strongly against hormone therapy. In reality, if successful, it makes the urologist's 30-minute job easier. But in my case, and I would think in most other unfortunates who have gone through this process, the procedure was an absolute disaster. Let me tell you why. During this therapy, my body went through a succession of significant changes. My breast area grew in size, and prolific hairs grew around my nipples and the back of my hands. I piled weight on around my hips, no matter what I did to reduce this. I broke out in regular hot sweats, my voice began to crack, and I had periods of uncontrollable crying. Leos don't cry. The whole experience was very uncomfortable and impacted on my male confidence and my relationship with my wife and family. At the end of the day, when it came time for the operation, my prostate had not reduced in size one iota. In my case, I thought I had done my due diligence in researching the best surgeon and had opted for open surgery as giving the best result. He insisted on having a second surgeon in attendance. To this day, don't ask me why. And that's when the whole thing turned to a disaster. While showing off to his fellow surgeon and talking to him at the same time with scalpel in hand, he managed to cut into the main artery underneath the prostate. The body contains 5.5 liters of blood. I lost 5 liters and nearly my life as to the severity of the cut. In the resulting panic to staunch the flow, the surgeon removed my prostate, nerves and all, to get to the damaged artery. In his hospital rounds the next day, he informed me there had been a complication, and unfortunately, he wasn't able to save the nerves, saying that it would impact my ability to have an erection and make me impotent as well. This was devastating for me in my 50s, otherwise in good health and with a much younger wife and a sexually active relationship. As another insult, and not previously discussed by the surgeon, I was clad in a sanitary dressing. Being told my ability to control urinary flow would mean wearing sanitary pads for several months until the function restored itself, which mine later did. A friend of mine of similar age, though, is still reliant on sanitary pads 9 months after his operation, which was keyhole. My ego took a major hit, as did my confidence, and in general, my well-being. At one point, even having a conversation with my wife, suggesting she consider another partner should she need to. Imagine that. Well, it got worse. My depression and loss of manhood taking a price on our relationship, which finally ended in divorce on the part of my wife. The story didn't end there. A friend of mine working in Thailand had a girlfriend who was keen to introduce me to a girlfriend of hers. Prior to going up there, I conferred with my family doctor as to whether there was anything I could do about my erection problem. He gave me a script for 20 injections, whereby I could inject into my penis 10 minutes before intercourse, and with luck, you'd get a semi-erection for 10 minutes. 5 days later, after my return from Thailand, I went to my doc again and requested a repeat. Well, as I expected, he read me the Riot Act and said I shouldn't use them that way, as every time I injected, the needle left a scar, and there was a possibility I would run out of room. He suggested a possible alternative, however, a penis implant. This was new technology I hadn't even heard of. It consisted of 2 parallel inflatable catheters being inserted into the length of the penis. These are connected to a tiny pump, about the size of a testicle, and located in between the 2 existing testes. A pouch containing a saline solution is inserted behind the lower stomach muscles, completely out of sight and feel. To inflate the penis, one simply applies the pump with 8 to 10 squeezes, depending on the hardness required, and voila, you have an erection. It gets better. That thing stays up for as long as you wish, all day if necessary, and only deflates when a small button on the pump is activated. This really is an extraordinary innovation, and has completely changed my take on life, and of course, my confidence in relation to women. The benefits are huge. No medication required. A 1-day hospital visit. Mostly non-invasive and can't be seen. It's discreet, no maintenance required, and there's a flexibility of hardness. Now the question of ejaculation. The removal of the prostate curtails the production of semen. So if you're planning on having a family, consider having your semen stored in a sperm bank prior to the operation. Ejaculation. Yes, you can achieve this. Probably 50% of the sensation you once had. The liquid, however, is not creamy and thick in consistency, but rather more like urine. The damage to those nerves running alongside the prostate will dictate your sensation of ejaculation, as those nerves run to the brain. As these receptors control sexual drive and desire, expect a reduction as a result. For those who are unfortunate enough to suffer from premature ejaculation, a penis implant may be the answer. In terms of cost, this procedure varies among countries. It's more expensive in the West, of course, although some costs are covered with medical rebates. Alternatives, though, are Asian countries ranging from India at around $11,000, Thailand at $15,000, and Turkey. It's a bit cheaper, but not recommended.